If you are looking to replace missing teeth, dental bridges can be a well-known and reliable choice. A dental bridge is made up comprising 2 or 3 crowns, which can be placed on opposite sides of the gap that is created due to missing teeth. The bridge is topped with an artificial tooth, known as Pontic, between. The bridge is then bonded in place and restores the functionality and look that your teeth have. There are many different varieties of bridges for dental use that may be employed according to the needs specific to the patient. The video below will look at the different kinds of bridges used in dentistry with their pros and cons. Traditional dental bridges. The most commonly used form of dental bridge is the standard dental bridge. It consists of 2 crowns that are put on the abutment teeth at either end of the gap. They are joined by the Pontic inserted between. The traditional dental bridges are composed of porcelain bonded to metal. This provides beauty and strength. One of the primary benefits that traditional bridges have is the fact that they're durable and durable. When properly cared for and maintained, an old-fashioned dental bridge is able to last for 10 years or even longer. Furthermore, traditional dental bridges are reasonably affordable when as compared to other forms of bridges used in dentistry. But a drawback to traditional bridges for dental use is that they need dentists to strip some of the enamel from teeth of the abutment to accommodate the crowns. The removal of enamel can reduce the strength of the teeth that are abutted and also increase the likelihood of tooth decay or infection. Cantilever dental bridges. Cantilever bridges for dental use are similar as traditional bridges for dental use, however they're supported by 1 tooth instead of 2. The type of bridge usually used if there's only 1 natural tooth next to the space. Dental bridges with a cantilever design is a great option if there's only 1 tooth that can be used as an abutment, however they're less durable and stable as conventional dental bridges, because they are only being supported from one end and has a lower possibility of failing or causing damage. Maryland dental bridges. Maryland dental bridges, sometimes referred to as resin-bonded bridges, are less intrusive for traditional bridges. Instead of crowns, Maryland bridges make use of either the wings of porcelain or metal connected to the back of adjacent teeth. One of the biggest benefits that comes with Maryland bridges is the fact that they don't necessitate the removal of enamel from abutment teeth. This makes them more sane. Maryland bridges can also be more affordable than traditional bridges and can easily be replaced when they are required. One disadvantage to Maryland bridges lies in the fact they're less durable and strong, unlike the traditional bridges. Maryland bridges tend to be utilized in front teeth that have lesser pressure and force, since they might not be capable of enduring the force of chewing that is present in back teeth. Implant-supported bridges. Implant-supported bridges are thought to be the most durable and reliable form of bridge made by dental implants. Instead of using nearby teeth to support the bridge, implant-supported bridges are secured in the jawbone by dental implants. Implants made of titanium are post-surgically inserted within the jawbone. They are there where they fuse to the bone to provide a sturdy base to the bridge. Implant-supported bridges are exceptionally sturdy and will last many years if they are properly cared for. One of the primary benefits of implant-supported bridges is the fact that they stop the loss of bone mass in the jaw. This could happen when teeth are missing. Implants are also a natural looking and feel like natural teeth. The only drawback to bridges that are supported by implants is that they're more costly and entail an extended treatment time. The procedure of receiving dental implants could take a few months, as implants must be able to integrate with bone prior to the bridge being able to be put in place. There are many different kinds of bridges for dental use that can be used to fill in the gaps left by missing teeth. Each one has distinct strengths and cons. The most effective choice depends on the individual demands and needs for the person. The traditional dental bridge is durable and inexpensive. Bridges that cantilever are a great choice for single abutment teeth. Maryland bridges are a budget-friendly and affordable option. Implant-supported bridges are also the most durable and reliable alternative. You should consult with your dentist about which option that is appropriate for your specific situation.